In the heart of Lagos, stakeholders in Nigeria's health sector gathered for a powerful symposium with the compelling title First Major Masquerades and the Attainment of Universal Eye Care in Nigeria. The 26th Annual Faculty Lecture by the Faculty of Ophthalmology, National Postgraduate Medical College of Nigeria, drew policymakers, public health advocates, ophthalmologists, civil society representatives, and students, all united by a shared goal, breaking down the barriers to accessible eye care for all Nigerians. In his keynote, the renowned ophthalmologist Dr. Oshoba used powerful metaphors to spotlight the systemic challenges plaguing eye care delivery. He revealed that over 4 million Nigerians live with moderate to severe visual impairment, much of it preventable. Conditions like cataracts, uncorrected refractive errors, and glaucoma remain unchecked due to high treatment cost, poor awareness, and limited access. Dr. Shoba called for better medical practices, urging Nigerians to stop relying on self-medication or harmful substances to treat eye issues.
Professor was blinded in both eyes. She had Apollo, University of Lagos, the Guinness Eye Center, and she saw Professor Adekunle Oshitelu, who gave some antibiotics for the eye. But after using it fast enough, and some people told her to apply sugar water and urine. She applied it, and this professor became blind. For members of the press that are here, please, we need to really be an evangelist to let people know that if you have simple eye condition, go to your nearest eye center, see the eye care practitioners, stop using things that will make the cure of the disease worse than the disease itself. Nigeria has adopted universal eye care. It is incorporated by the Federal Ministry of Health, the National Council on Health, and it is something that we are in the process of implementing. And it is about giving comprehensive eye care services through health promotion, through education, prevention, treatment, rehabilitation, and rehabilitation. Treatment for visual loss and enable people to adapt. Universal eye care is a comprehensive, equitable, and integrated approach to eye health that ensures that everyone has access to the service they need to maintain optimal vision and prevent avoidable blindness, ultimately contributing to overall health and well-being. And the essence of this lecture, therefore, is to emphasize the fact that whereas red eyes, ocular injuries, foreign bodies, many systemic diseases with ocular manifestations, they are not among the top main causes of blindness and visual impairment in Nigeria. Their proper identification and management is a sine qua non to the attainment of universal eye care in Nigeria.
Chairman of the occasion and Chancellor of Ekiti State University, Dr. Olatunji Kayode Olowolafe, reaffirmed the commitment of the Faculty of Ophthalmology. He pledged to boost the training and surgical capabilities of future ophthalmologists.
Certified only 454 fellows. Nigeria is growing at 2.7% per annum. Nigeria today has a population of about 220 million. There are 6 million new children with eyes every year. So we need to take note on how to correct the imbalance. I'm informed that this annual lecture series is one of the faculty's strategic efforts to bridge the gap.
Professor Charles Bekibele, chairman of the Faculty of Ophthalmology at NPMCN, raised a pressing concern: the critical shortage of eye specialists in the country.
Due to several barriers, including poor outcome, the faculty is determined to improve the surgical outcome of its trainees and fellows. One of our accredited training centers at Ibadan, the Eleta Eye Institute, was recently promised a simulator-assisted cataract surgery training machine, which is expected to revolutionize cataract surgery training with subsequent improved outcome in Nigeria. However, more of this equipment are needed, both at the college and in other regions within the country. We are therefore using the opportunity of today's lecture and the launching of our endowment fund to request your kind support and generous donation towards acquiring this equipment, whose cost is over $100,000.
The machine alone cost over $100,000, but it's a crucial step towards saving millions from preventable blindness. Leaders from the Medical and Dental Council of Nigeria, including Registrar and CEO Professor Fatima Kyari, lent their voices in support, all calling for united action.
The annual lecture series of the faculty has over the years become a platform of intellectual discussion, debate, and distinction. A gathering where bold ideas are shared, topical challenges are explored, and the future of specialist training and service delivery in ophthalmology is envisioned. Today's lecture, with the evocative theme, force majeure, masquerades, and the attainment of universal health care in Nigeria promises nothing less. We are especially honored to welcome our eminent guest lecturer, Professor Festus Oshoba, a respected figure in ophthalmic care and training, whose contribution to the field continues to resonate both within Nigeria and beyond our borders. His unique perspectives, shaped by years of clinical, academic, and administrative experience, is certain to provide thoughtful engagement and offer direction as we continue to confront the realities of healthcare systems strengthening in Nigeria. The theme of today's lecture speaks to the layered complexities, natural, systemic, and sometimes cultural, that influence access to healthcare in Nigeria. It challenges us to critically assess not only the obstacle, but also the opportunities on our path towards achieving universal eye care. This goal is consistent with the broader objectives of universal health coverage and the Sustainable Development Goals. The college deeply appreciates the Faculty of Ophthalmology for sustaining this important tradition of scholarly reflection and advocacy. Your commitment to excellence in postgraduate medical education and specialist training is exemplary and continues to enhance the college standing nationally and internationally.
When I came, those who are now professors were my residents, and now they've also matured, and I have what you can call third or fourth generation of professors who are ophthalmologists. It has helped the country because when I came we were very few, but now there are many of them and they are pulling their weight. I'm proud of them. We still need to train more ophthalmologists, but they qualify as doctors. That takes another 5 years. Then they go for youth corps, another year, and then they now come back to spend 6 years to specialize as ophthalmologists. So they must be interested, and if they are interested, government must be able, to give them the tools to work with and encourage them. If they do that, they will stay, definitely. Government will try. Let's give them some time. And I'm sure that our own doctors too, many of them are now staying behind so that they can also pass on the torch which I passed on to them.
Most of the challenge we have has to do with, training. For one thing, we're supposed to train and certify ophthalmologists, but of recent, because of the so-called jackpot syndrome, a number of our young people, they don't stay anymore. They would rather Some will abandon the program, some will not even come in at all. So we have a lot of challenge with that, getting enough people to train to replace our old teachers. So that's a big challenge. The other challenge we have that it's to some extent we are addressing from this faculty lecture is the problem with getting simulators to train people in cataract surgery. Cataract surgery is the most common cause of blindness in Nigeria. So yes, we currently train first. We do some kind of step surgery, and then our residents are now exposed to live surgery. But it will be much easier if we have simulators, just like pilots. A pilot is trained with simulators before they start flying the plane. So, and thank God people have produced this innovation where you use simulators to train surgeons first, and then they practice and master the art before they go on to human beings. Currently, we don't have any simulator for cataract training in Nigeria, but we've been working hard to get one. One of our training institutions has been promised one, but it hasn't come at a letter ICT Ibadan. It hasn't come, but the faculty needs more. Nigeria is big, so the need is huge. Luckily, one of our chairman for today has promised to donate one of such equipment for the college that we can have at the Janiki College at the Janiki, and we can use that to make sure that our ophthalmologists are properly trained on cataract surgery. About 5 years ago, yes, we had 30 trainees at the University College Hospital in Ibadan. They finished, none of them stayed back, they virtually all left the country. Currently, we have just 5 trainees in a big institution like that for ophthalmology. It's not that we don't advertise, we advertise, but they don't apply. So what do you do? So it's a big challenge. If you solve Nigerian economic problem, there will be a reverse trend to immigration. There will be a reverse trend. I honestly believe that people will come back. Many of them who have left will come back. The economy is better.
We had only 454 ophthalmologists trained so far for more than 220 million. So our chairman of the occasion is trying to help us so that we can have a simulation lab, so that we can have high quality training. The government is trying to establish more medical schools so that we can encourage many more people to study to become doctors. But the thing is that after you have gotten your primary certificates as a doctor, then you need to do another 6 years before you can become a specialist. Even after becoming a specialist, you still have to do some more years to train in areas of the eye again. So it's a super specialty. And therefore, all of us should support everything that is done for eye care so that the world can be a better place to live in. We need to exercise ourselves so that there can be good blood supply to every part of the body, including the eyes, so that we can see well. Again, we want to encourage that people should go and see the doctor when they are not sick, because many eye conditions are preventable and most are curable. Again, I want to talk about glasses, because now we use a lot of computers. And some people, when they use the computers and they don't get their eyes tested, the eyes get discomfort, and that can lead to problems. So if you use computers a lot, make sure you see your eye doctor, let them check you and see whether you need an aid so that you can be able to perform better. Also, generally, all of us should be like a doctor in our house. When you're in your house, maybe in your sitting room, make sure that there is an object, a calendar or something that you can point to. Maybe the letters there. When you wake up in the morning or maybe last thing at night, make yourself a distance and look at that thing. Close one eye at a time and look at it and see whether you can see it. Keep doing it. Any day you find out that what you have been seeing before, suddenly you are not seeing it again, that is the time to see the doctor. And because very simple treatment, prevention, and you'll be fine. Because here we need to shine our eyes in this kind of economy we are in. Everybody is going through one area or the other. We need to be more productive to improve our economy. So therefore, this topic is very germane and very important for the attainment of universal eye care, which is a policy of the federal and state governments of Nigeria.
The high point of the symposium, the official launch of an endowment fund to acquire the much-needed surgical simulator. Individuals who have shown exceptional dedication to eye health were honored with awards of meritorious service.
26th Annual Faculty Lecturer, titled Force Majoring Masquerades at the Attainment of Universal Eye Care in Nigeria. Today, 11th July 2025.
An inner-spirited moment. Winners of the annual Oshutokun quiz competition were recognized for their brilliance and promise. As the 26th faculty lecture came to a close, the message was clear. Collaboration across ministries, NGOs, and professional associations is vital.
It's a simulator that will enhance training and also help in diagnosis. It's just for us to be globalized. And we have the best set of doctors in the world, and our ophthalmologists are particularly special. We have 454 of them that are fellows, well-trained, well-renowned, known worldwide. So I'm sure they're trying to build a center of excellence that would attract other people, patients from all over the world, so that they can have diagnosis and training.
The fight for universal eye care in Nigeria is far from over, but with commitment and innovation, no one needs to be left in the dark.